Welcome to the Health Insurance Store podcast, where we discuss all things health insurance, Medicare, Obamacare, group health insurance, prescription drugs, you name it, we'll go over it. We're going to pull the curtain back on a lot of things healthcare related. So listen in today as we discuss my latest column in the Post-Gazette. So I want to go ahead and start doing these where we can. For those of you who don't know, I do a column in the Post-Gazette that runs every Friday on page A2 and every Tuesday in the Trib on page A7. Those are both our Pittsburgh papers. And I want to kind of just get in a little more in depth on the questions that we ask that I can do in just a short column that we do. So the latest question we had, the last question, came from Patricia. And her question was, I think I get the differences between supplements and Advantage plans. However, I'm not clear on how you add prescription coverage. Most people who are complaining are doing so about the cost of medicines, and I would like to avoid this if possible. So that's a great question, and there's definitely some differences in how Advantage plans and supplements, people who choose those, get their Part D prescription plans. And again, very quickly, for those of you who don't know the differences, Advantage plans are not a secondary to Medicare like supplements are. Supplements are secondary to Medicare. You use your Medicare card and your supplement card, aka Medigap, to fill the gaps in Medicare, and those who have supplements to pay little or no money out of their pocket. Advantage plans don't work like that. They are used in place of Medicare. In other words, instead of Medicare doing what they traditionally do, paying 80% of your bill, what Medicare does is, instead of doing that, they pay a private insurance company about $800 a month to become your one and only insurance. So there is no secondary. That HMO or PPO that you get, Advantage Plan HMO or PPO, is your only card that you carry, and you'll show that card for everything. So again, that's just, if you want to go back and look at some other columns that discuss those differences or listen to some other podcast, you can go to our website at getyourbestplan.com. That's getyourbestplan.com. And I guess I better introduce myself, who I am. I kind of forgot to do that in my introduction. I am the president and founder of the Health Insurance Store. We are home of the Medicare specialists, and we were founded, actually April 1st was this year was our 12th year in business. And so we've got over 10,000 active clients, and that's what we do, is we help people find their best plan, and that's our website. We meet with people. We advise them based on their healthcare needs and budget, which is the best way to go. Again, we do Medicare supplements, Advantage plans, Part D plans. We do individual health insurance and group health insurance. That's what we do. We do not do any other type of insurance. We do not dabble in property and casualty or in investments or in life insurance. We just do healthcare-related products only. So let's get back to the question of, the differences. How do I get my prescriptions if I take an Advantage plan as compared to a supplement? So let's start with Advantage plans, because almost all Advantage plans come with Part D embedded in them, hence the acronym MAPD, which stands for Medicare Advantage Part D. So the only people who generally choose plans without prescription coverage on their Medicare Advantage plans would be those who can get medications through another source, namely PACE or PACEnet, which is prescription assistance, the state. That's funded by the state lottery, Pennsylvania State Lottery, or the VA. People who have VA coverage also can get prescription coverage. So one of the actually most popular plans among our clients is an HMO that doesn't have drug coverage, because it has the lowest out-of-pocket, maximum out-of-pocket on the market, as well as really competitive copays for hospitalizations, among other services. I guess I need to go back, and again, the differences between Advantage plans and supplements. People on supplements pay little or no money out of their pocket for medical. People on Advantage plans are going to have copays for virtually every service. And so the question might be, well, why would anybody do an Advantage plan? Well, they can be less money. So Advantage plans you can get for as little as $0, believe it or not. And remember, that's because they're getting $800 from a third source per month, and they can give Advantage plans for $0. They're going to dangle those out there as an enticement for you to enroll in them. So again, let's go back to Advantage plans that do have drug coverage. Generally, the most of them do. Only 5% of them don't come with prescription drugs, and then that's especially kind of a special plan for people who can get PACE, PACEnet, or VA coverage. So companies that actually have prescription drug coverage in their HMO or PPO Advantage plans actually have to split the monthly premium among medical and prescription. So in other words, if you had a plan with a $50 premium, it might be broken down as $13 for the medical and $37 for the Part D portion. And if you have your Medicare Advantage plan premium deducted from your Social Security check, you can see what those costs are in the statement that you get every November. So again, those on Medicare Advantage plans show one card at their Medicare providers and medical providers and at the pharmacy. And a Medicare card, again, is not necessary, again, since Advantage plans are designed to play in pace of Medicare, not in addition. So again, see last week's column. Again, you can find it on our website, getyourbestplan.com, and you can find where we discuss those and the podcast that we had that discussed that in much more detail. So people who have supplements actually have to purchase what is known as a standalone Part D plan. That's another policy that's bought and billed separately. So it's usually provided by a different company than the company who your supplement's with. And the most popular plans for 2020 run between $13 and $22 a month. I'd say 90% of our clients who have supplements, that's their premium on their Part D plan for 2020. And we do change those almost every year for people. So I'd say our clients have a 50-50 shot of changing their Part D every year. And that's very, very important to remember. A lot of people fail to make that, compare them every year and make sure they're getting the plan with that keeps the most money in their pocket. We've seen from one year to the next, people not switching plans can be throwing away as much as $1,000. So we do that for every single supplement client we have. We get a list of their updated medications, and October 1st, we start making those searches on Medicare's website and ensure, again, that our people have the most cost-effective plan for the following year. People who have supplements, again, they're going to have a standalone Part D plan, what's called. They're going to carry 3 cards. Their original Medicare card, the white card with a red and blue stripe, a supplement card that they're going to show those 2 cards at a doctor, hospital, or lab, and they're going to have a 3rd card they're going to use for their prescriptions, and that is their Part D plan. Okay, so again, that's just a difference in how those work between supplements and Advantage plan, how you acquire them. Coverage is pretty similar between the two. We're going to talk about the one big difference here shortly, but Patricia stated in her question that she often hears the complaints that she hears from people on Medicare are about the high cost of prescriptions. So generally those complaints are coming from people who fall into what's called the donut hole. So you may have read that the donut hole was supposed to go away. It didn't. That was a big fat lie that was perpetrated by the CMS and other politicians, that it was supposed to go away as it was promised. We were supposed to get a discount, and then that discount was to increase until we didn't have a donut hole. Well, I'm here to tell you that the donut hole went away in name only. It's now called the coverage gap, is how it's referred to. It's no longer referred to as a donut hole, and I'm very, very disappointed that it didn't go away as promised. And it's also upsetting that you hadn't seen that in the media at all. Zero coverage of that. Again, not only did it not go away, but it got worse for seniors in 2020. Again, that's a topic for another day. But let's talk about what the donut hole is really. Again, how the donut hole works is you can only receive $4,020 in retail medications, okay, before you hit the donut hole. What your co-pays, what you pay for your medications have no bearing on that. In other words, only thing that's taken into consideration is the full retail cost of your medications. That's what counts towards that $4,200. And with brand name medications now averaging between $400 and $700 retail for a 30-day supply, it's not going to take long for you to hit the donut hole. So all these newfangled non-insulin medications that you're seeing, Victoza, Ozempic, or excuse me, not Victoza, or I think Ozempic, and a couple other ones, they sing happy songs on TV that act like diabetes is a great thing to have, and all these people who have it are happy. Well, those drugs cost $700 a month, $700, and they're being widely prescribed right now. So somebody who had one of those medications is going to hit their donut hole in 6 months. So you might be paying $35 to $47 for those medications before you hit the donut hole. Then one day you're going to go to the pharmacy and you're going to be in the donut hole, and the pharmacist is going to say, that'll be $175, please. And, you may want to faint, but you're going to pay that $175 for the rest of the year, more than likely, once that donut hole's hit. So be careful, guys, out there. And, you want to question, why your doctor wants to put you on these really expensive medications. Most physicians don't know what the costs are. They don't understand what happens when people hit the donut hole. And, one of the questions I get all the time is, well, can I avoid the donut hole by moving to another Advantage plan or moving to another Part D plan? Well, the answer is no. That's a Medicare thing. It is not a plan-specific thing. So you can't avoid the donut hole by switching from a standalone Part D to an Advantage plan or an Advantage plan to a standalone Part D plan. And you can't avoid it by paying more for your Advantage plan or Part D plan. It's going to be there no matter how much you pay, and that's why most people are going to be better off on Part D plans that are low cost, and also why we recommend Advantage plans that are low cost. There's no benefit in prescription drugs by paying more money, paying more premium. And so you're not going to get out of the donut hole until you've spent about $2,500 out of your own pocket before you get in what's called the catastrophic drug coverage, where prescriptions will become affordable again. You know, I've often said it should be called the black hole, not the donut hole. Donuts are good, right? Watching your money disappear isn't good. And that's what happens when you hit your donut hole. So that's, again, I don't care whether you have a Part D plan and a supplement or an Advantage plan, the donut hole is gonna be there. I would like to point out that really the only difference between standalone drug plans and Medicare Advantage drug plans is standalone drug plans have a deductible of $435 now for Tier 3, 4, and 5 drugs. So Tiers 1 and 2 on almost all Part D plans are not subject to that deductible. Up to this year, there were a couple other low-cost Part D plans that didn't have a deductible, but that's no longer the case. And a lot of people had a plan. I'm not allowed to say the names of these companies, but a lot of people had a plan, and they just took it again because they assumed there was no deductible. And boy, were they surprised this year when they found out there was one. So, that Medicare Advantage plans do not have, in Western Pennsylvania right now, do not have that prescription drug deductible on Tier 3, 4, and 5 drugs. So that can be a factor when determining what type of plan you might want to choose, but shouldn't be the only one. Please, I want to make this clear, shouldn't be the only one people consider when deciding between an Advantage plan or a supplement. There's much more to consider than that. And again, we've discussed those in some of our last podcasts and columns. Again, please go to the website if you want to review some of those. Now, there are some ways to avoid the donut hole and get help if you find themselves there. So if you'd like some guidance in that regard, you can feel free to reach out to us, and a member of our team will be glad to help. You know, we have years of experience and knowledge in several programs and tricks that the drug manufacturers would rather not know about, and we never charge for this type of advice or any other consultations to go over, your medical options. So again, there's PACE and PACE-Net that will help you avoid these. There's foundations that you can get for that will help you pay for prescription drug costs that vary. Again, some other things people don't do nearly enough is question their doctor. Why do I need to be on this expensive, what are the other alternatives? Are there other alternatives? What can we do? Use your pharmacist as a resource. Hey, Mr. or Mrs. Pharmacist, my doctor put me on this medication. Do you know anything in generic that maybe we could substitute, that could be taken, that you think would be a good substitute that can help lower my costs? And then take back that back to your doctor and see what he or she thinks. There's Canadian pharmacies that can offer some relief that a lot of our clients use. So again, we can help you with that. We help all our clients with that when the need arises. I do want to let everybody know that the health insurance store is open for business during the COVID-19 crisis. We are not able to meet people face-to-face, but if you're new to Medicare or retiring, we can go over your options via the phone or in what we call a virtual appointment online, where we can interact with you on Zoom. You can interact live with an agent, and it's almost like being across the desk from us. It's as close as you're going to get during this time. Again, if you're a client and you have questions or issues, we're here at the office. We have a crew here. Our support staff is here to help you. If you'd like to make an appointment, you have questions. If you'd like to speak to an agent or make an appointment, you can reach out via the phone, 724-603-3403. That's 724-603-3403. Or visit us on the web at, again, getyourbestplan.com, where you can also find those archived columns as well as recent podcasts. Follow us on Facebook also for the latest healthcare-related news and information. That is going to about put an end to us today, but we look forward to hearing you again. And this is Aaron Zolbrod from the Health Insurance Store signing out. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the Health Insurance Store.